Good morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan, Vihar University. Today I will discuss about the topic is drug information services. Drug information services. First of all, discuss the learning objectives of this topic. Learning objectives of this topic. Upon completion of this topic, the student should be able to, first of all, introduction of drug information services. Next one is history of drug information services. And next one, need of drug information services. And next one, objective of drug information services and source of information, drug literature evaluations, drug information bulletin, and last one learning objective is poison information services. Next one, learning outcomes of this topic. On successful completion of unit, students will able to like introduction of drug information services and history of drug information services, and next one is needs of drug information services and objectives of drug information services and source of information for drug information services and drug literature evaluations of drug information services, and next one drug information bulletin of drug information services, and last one learning outcome is poison information services. Next one, first of all, discuss the introduction of drug information services. It is the current relevant, critically examined data about drug and drug use for given patient or situation. And next one, many institutes run drug information center for the provision of drug information and to every group kind of people from any palace. Next one, history of drug information services. First drug information center was developed in University of Kentucky, in 1960. In United States, 80% of hospitals having drug information center. In United States, 80% of the hospitals having drug information centers. Next one, Nepal in infancy stage with a few centers. And next one, in Nepal, DTA has started this type of services. Next one, needs of drug information services. What need the drug information services? First of all, the number of drugs. The number of drugs in the international market has increased very much. The first one need of drug information, the number of drug in the international market has increased very much, and next one, the newer drugs are generally more potent and selective and formulation becoming increasingly complex, and the literature on drug has also expanded and covers with wide range of informations. And to introduce a new drug into the practice, and the professionals needs to evaluate the given information. And next one, a simple quick reference to a pharmacopoeia or formulary is no longer sufficient. Next one, aim and objective of drug information services. Aim and objective of drug information services, the provision of information to health professionals on specific problems related to the use of drug in particular patients. And next one, the provision of information to officials in government agencies to optimize the decision and making process, the PP, the preparation and development of guidelines and formularies. Next one, to improve patient compliance and to provide a guide to responsible self-medication. And next one objective is to develop and participate in continuing education programs. Next one, to participate in undergraduates and graduates teaching programs. And next one objective is to develop educational activities regarding the appropriate use of drug for patients in the community. And next one objective to prepare and distribute material on drug to health personnel in the form of a drug information bulletin and or other media. Next one, to develop and participate in research programs. Next one, the source of information and resource available. The source of information is three types. First one is primary source, second one is secondary source, and third one is tertiary source. The first one is primary source, in which primary source information is presented by authors with without any evaluation by a second party. In which primary source the information is presented by authors and without any evaluations by a second party and provides next one provides most current information about drugs. And next one, examples of primary source like article published in journals, example British medical journals and thesis, etc. And next one source is secondary source, in which secondary source the original source has been evaluated by second party other than the publishers. The secondary source has been evaluated by second party other than the publishers. Next one, modified and rearranged form. Example of secondary sources like review articles like LASIX, NASIX, and Medline, etc. Next one source is tertiary source, and which tertiary source information obtained from primary and secondary source and arranged in a manner to represent a composite of the available informations. And example of tertiary sources like representative from pharmacopoeias like British Pharmacopoeia, next United States Pharmacopoeia, Indian Pharmacopoeia, and British National Formulary, etc., and encyclopedia and dictionaries, guides, textbooks that are the sources of tertiary sources for drug information services. Next one, other sources of drug information services like the Drug Information Center also receives information from the public and hospital about the adverse effect of any drugs, the public and hospitals about the adverse effects of any drugs and local drug lists. And next one, national formularies and hospital formularies, internets and phone calls to manufacturer and government and non-government organizations and also to the other drug information centers. These are the other sources for drug information services. Next one is Drug literature evaluations. Drug literature evaluations. Among the skill of Among the skill of drug information is knowledge of drug literature. Among the skill of drug information is a knowledge of drug literature evaluations, which allows one to provide a critical analysis of the literature and have a better understanding of the studies and done in health and medicines. And next one, it is a key components to provide a good quality answers to a requester. The drug literature evaluations is a key components to provide a good quality answers to a requester. And next one, the being able to separate good data from poor data is essential, and knowing the limitation of any study can help in evaluating the unability usability of its data. And next one, drug information specialists will often use some standard questions to help in this process. And next one, the several references provides guides to evaluate the medical and pharmacy lecture literatures. Next one, the journal guideline for response to drug information, like do not guess and take several ethical issues into account. The first one, patient privacy must be maintained. The patient privacy must be maintained, and patient physician relation can't be branched, breached. And next one, response is not necessary if the inquiry's intents and to misuse or abuse the information that is provided. Next one, organize information before attempting the communicate the response to inquiry. And next one, tailor the tailor the response to the inquiry's backgrounds. And next one, tell the inquiry where the information was found and alerts the inquiries of possible delay when it takes longer than anticipated to answer the questions. And next one, ask if the inquiry's questions is answered by the information. Next one, Drug Information Center. DIC means Drug Information Center. The Drug Information Center is journal or service providers and which provide drug information relating to therapies and pharmacoeconomics, educations and research programs. And it provides unbiased information to healthcare professionals and our patients and consumers. Next one, many centers also provides workshop or other forms of training to enhance the skill of healthcare professionals. And a drug information center is usually a unit located within affiliated with a larger organization, and example a pharmaceutical associations, a hospital, etc. Next one, staffing. First of all, pharmacist, specialist with proper knowledge of drug and action associated with academic degree, and they provide drug information. And pharmacy technicians and students, they assist pharmacists in providing drug information like literature searchings and retrieval of data and resources updating, etc. People spend in library science with computer knowledge, and they are supporting staff and drug information centers for their own experts. Next one, the center should have specific hours of operation, like 24 hours preferably, and adequate technological resources, example computers, phone lines, and access, etc. The Drug Information Center should have the latest publications and ideally publish a newsletters of other informational updates. And the role of pharmacist in Drug Information Center. First of all, must be a part of Drug Information Center and should be readily to go for information all the time. And the drug information pharmacist is at interface of best amount knowledge on sites and the person needing the knowledge on other. Next one, note the far the primary role of a drug information center in a developing country is to give clear and definitive informations on well-established essential drugs and promote their rational use. The pharmacist is play the primary role of drug information services like give clear and definitive informations on well-established essential drugs and promote their rational use of drugs. A secondary role would be to keep up to date with pharmacological and therapeutic literatures and to disseminate relevant information as they become available. Next one, drug information bulletin. Drug information bulletin. What is drug information bulletin? It publishes the latest developments in medical science. Drug information services, drug information bulletin. It's published the latest developments in medical sciences and the newly introduced drugs and new indications and other information regarding drugs. And one of the pharmacy and therapeutic committee duties to assist the pharmacists in conducting and teaching programs within the hospital through a pharmacy publications. And the method employed to disseminate and interdepartmental informations are usually bulletins and bulletin boards notice and committee meetings. The bulletin normally published the latest development in the medical sciences, the newly introduced drugs, new indications for certain drugs, and newer drugs delivery systems, and update on drug interactions and adverse drugs reactions. Next one, pharmacist is normally held responsible for its publications and how we are contributions are obtained from pharmacists and physicians and nursing and other interested groups like therapeutic dietitians for food drug interactions for publishing the bulletins. Next one, the content should however be educative and informative. The content should however be educative and informative. Next one, poison information services. Next one, poison information services, PCC. PCC means Poison Control Center. Poison Control Center for the provision of services regarding poison and related danger and to manage with the poisoning cases and concepts initiated in Chicago in 1953 and Poison Control Center were established for two reasons. First one, to provide rapid rapid access to information valuable in assessing and treating poisonings. And next one, to assist with poisoning preventions. Next one, staffing for poisoning information services. First of all, pharmacy team, pharmacist, specialist trained in poison information and in the management of poisoning emergencies. And next one, pharmacy technicians and students are involved in the pharmacy team. And next one, medical team, toxicologists specializing in medical toxicology are also available for consultation. And next one, supporting team, people trained in library science with computer knowledge for the staffing. Next one, functions of poisonous information services like access and treatment recommendation during poisoning via 24 hours emergency telephone services. Next one, provide public and professional educational programs and to collect data on poisonings and to perform research. And next, the assist the public and healthcare providers during hazardous material spills. Next one, common calls. My daughter is 2-year-old and just swallowed half a bottle, half a bottle of PCM. And I just turned my heater on for the winter season and I am feeling light at and I am 72-year-old and think I took a double dose of my medicines. And next one, I have a patient who swallowed. Next one, the inquiry should explain exact name of the product. The inquiry should explain the exact name of the product involved, have the container and close at hand, and amount of poison that present that person was exposed to, any symptoms and time of exposure, and as and weight of the victim, and any health problems the person has, and any treatments that has been given. And next one, where the person is and how the person was poisoned. These are the queries should explain by the. Next one, call handling process. First of all, obtain history of the patient and then consult references. And next one, assess risk and formulate treatment plan and communicate assessments and recommendation to client. And next one, complete coding and documentation of the patient. Next one, emergencies treatments of poisoning. Emergencies treatment of poisoning. First, poison any substance that can harm the body by altering cell structure and function. The poison are harmful for the body by the altering cell structure and functions of cells. Next one, toxins, a poisonous substance secreted by bacteria, plants, and animals. Example, mushrooms and variety of plants and bacterial contaminants in foods, and common ingested poisons and common ingested poisons like acetaminophen and acid and alkali substance and antihistamines drugs and food poisonings and insecticides poisons and petroleum products and plants. These are the common ingested poisons and emergency treatment of poison. Next one, route of poisoning. Route of poisoning, first of all, inhalation route, and next one is absorption route, and next one is injection routes. By the injection cause poisoning, and by the inhalation cause poisoning, and by the injection cause poisoning, and by the absorption cause poisoning. Next one, acid and alkali substance cause burns on a around the lips. The acid and alkali substance. Acid and alkali substance are first one, burns on or around the lips and burning in mouth, throat and abdomen and cause the vomiting. And next one, food poisoning. Food poisoning are cause various types of signs and symptoms, and food poisoning cause the abdominal pain and cause the nausea and vomiting and cause the diarrhea, and last one, food poisoning cause the fever. Next one, insecticides. Insecticides cause the slow pulsate and excessive salivation and sweating. Next one, insecticides cause the nausea, vomiting, and diarrhea. And next one, breathing difficulties. Insecticides after taking insecticides cause breathing difficulties and constricted pupils. Next one, petroleum products. Next one, petroleum products are characteristics, odor, or breath, clothing, and vomitus. And next one, coughing and difficulty breathing by the petroleum products. Next one, range of sign and symptoms. Range of sign and symptoms like non and nausea and vomiting and cardiac arrest. These are the range of sign and symptoms. Next one, important questions to consider asking. Important questions to consider asking. First of all, asking to patient, what substance, what substance intaking, and when did you ingest, and when did you ingest become exposed, and and if an ingestion, how much did you ingest, and over what time period, and what interventions, and how much do you wait, and what effect are you experiencing from the ingestion. These important questions are considered asking to the patient. Next one, ingestion. Ingestion. Poisons that are swallowed like household and industrial chemicals. Poisons that are swallowed, household and industrial chemicals. Next one, medications and ingestion of improperly prepared foods and ingestion of plant materials and ingestion of petroleum products. Next one is agricultural products. These are the poisons that are swallowed. Next one, ingested poisons. Ingested poisons, like sign and symptoms of ingested poisons like nausea, vomiting, diarrhea, altered mental status, and abdominal pain, and chemical burns around the mouth, and different breath odors. Next one, emergency medical care for ingested poisons like remove from unsafe environment. First of all, remove from unsafe environments and maintain airway and provide oxygen. And next one, remove pills, tablets, and fragments with gloves from patient mouths as needed and without injuring oneself. And next one, consult medical directions, and activated charcoals are used for the emergency medical care. And bring all containers, bottles, labels, etc. of poison agents to receiving facility. Next one, ingested poison. First of all, take standard precautions. First of all, take standard precautions and gather informations for ingested poisons and consult medical controls, and then if directed administered charcoals, and after that administered charcoal poison position patients and have suction available, and then ventilation if needed. Ventilation provides if needed. Next one, administration of charcoal. Administration of charcoal. First of all, consult medical control, and then sack containers slowly, and then provide covered container with a straw, and then delay in drinking, and sack and stir again, and record name, dose, and time of the patient. Next one, strategies. First of all, antidotes, few and limited. The use of antidote is few and limited, and prevent absorption by the charcoal, and supportive care like airway management, oxygenations, treatment of shocks, and kidney dialysis. These are the strategies. Next one, patient care in health poisons. How to care of patient in case of inhaled poison. First of all, remove from source of poison. Remove the source of remove from source of poison, and then establish airway and provide high concentration oxygen, and then expose chest to circulations, and then do focused history and physical exam like vital signs, and transports being all containers, bottles, labels, etc. of poison agents to receiving facilities, and consults medical controls and perform ongoing assessment. Next one, absorption. Poisons taken in through unbroken skin. Poison taken in through unbroken skin. The corrosive or irritants cause corrosive and irritants, and through bloodstream, and insecticides and chemicals. Next one, absorbed poisons. Sign and symptoms of absorbed poisons like liquid or powder on the patient skin, burns, itching, irritation, redness. And next one, emergency medical cares like first one is skin. Remove contaminated clothing. Remove contaminated clothing while protecting oneself from contamination, and powder brush powder of powder brush powder of patients, then continue as for other absorbed poisons, and Liquid irrigants with clean water for at least 20 minutes. And eyes irrigates with clean water away from affected eyes for at least 20 minutes. Next one, patient care by absorption. First of all, detect and treat life threats and then do focused history and physical exams like vital signs and remove the poisons from the site and powder, brush off and liquid irrigates with water for at least 20 minutes. And next one, transports with container, bottles and labels if safe and perform ongoing assessment of patient. Next one, toxic injections. Signs and symptoms of toxic injections like weakness, dizziness, chills, fever, nausea, and vomiting. And next one, emergency medical care. First of all, airway and oxygen, and be alert for vomiting, and bring all container bottles, labels, etc. of poison agents to receiving facility. Next one, alcohol and substance abuse. Emergency medical, emergency medical cares like establish and maintain a patient airway and administered oxygen as needed. And if the patient is responsive and try to get him to sit or lie on a structure and monitor the patient's mental status and vital signs frequently and try to maintain proper body temperature during the alcohol and substance abuse and take measures to correct or prevent shocks and protect from self-injury and stay alert for seizures and transports. Syrup of Epicac, not so used and reasons for removal and it is said that is take too long to cause vomiting and it does not remove enough of poison from the stomach and indications poisoning by mouth. Next one, antidotes, drugs and antidotes of drugs like morphine antidote is the antidote of morphine is naloxone and the antidote of benzodiazepines is clomazanil and the antidote of barbiturates is tacrine. The antidote of acetylcholine is atropine and the antidote of warfarin is vitamin K and antidote of isoniazid is vitamin B6 and antidote of insulin is dextrose or glucagon and antidote of paracetamol is acetylcysteine and antidote of heparin is protamine sulfate. That are the antidotes of drugs. Next one, references like Watan J. Source of Drug Information, November 2012, and Requirement of Drug Information Centers, FIB, Pharmacy Information Section. And next one, Chauhan and Etiol Indian Aspects of Drug Information Resource and Impact of Drug Information Center on Community and J. Advanced Pharma and Tech Res of June 2013, Volume 4, at issue second. And next one, promoting rational use of medicines and core components and World Health Organization policies, perspective on medicines, September 2002. These are the references for this topic. Next one, multiple choice questions of this topic. First one question, journals are which category of source of information? Journals are which category of source of information? Option A is primary, option B is secondary, option C is tertiary information, option D is none. The right answer is A. Primary information is the source of journals. And next one question, NLM is NLM is option A is National Library of Medicine, option B National Law of Medicine, option C National Library of Media, option D none of the above. The right answer is A. NLM is National Library of Medicine. Next one question. Medline is Medline is option A, online system of medical learning analysis and retrieval system. Option B, online system of medical library analysis and retrieval system. And option C is online system of medical literature analysis and retrieval systems. Option D is none of the above. The right answer is C. Medline is online system of medical literature analysis and retrieval system. Next one question. The misapplication of a good rule is which type error? The misapplication of a good rule is which type of error? Option A is knowledge-based error. Option B, rule-based error. Option C is action-based error. Option D is all of the above. The right answer is B. Rule-based or rule-based error is a misapplication of a good rule. And this error is rules-based error. Next one. DIB is a option A is drug information bulletin. Option B is drug information bulletin. Option C is drug increase bulletin. Option D, none of the above. The right answer is A. DIB is a drug information bulletin. Next one question. Reviews journals are which type of source of information? Option A is primary information. Option B is secondary information. Option C is tertiary information. Option D is none. The right answer is A. Review journals are primary information or source of information. Next one question. Short form of monitoring and evaluations of drug interaction by a pharmacy-oriented reporting is option A, NET-T4, option B is NEDI4, option C is NEDI4, and option D is none. The right answer is C. NEDI4 is right answer. NEDI4 is monitoring and evaluation of drug interaction by a pharmacy-oriented reporting. Next one question. Following comes under secondary source. Option A, thesis. Option B is conference. Option C is report. Option D is textbook. The right answer is D. Textbook is comes under secondary source. Next one question. Following is important computer program. Option A, Medlars. Option B is Medline. Option C is Medi4. Option D is all of the above. The right answer is D. All of the above is right answer. The Medlars, Medline, and Medi4 is the important computer programs. Next one question. Full form of YC is option A is preparation of information system effectively. Option B is procurement of information system effectively. Option C is procurement of information system efficiently. Option D is preparation of information system efficiently. The right answer is B. Procurement of information system is effectively? The right answer is B. Thank you. Thank you all of you for a wonderful session.